Our sisters came to West Virginia in 1853, and we began by teaching, by responding in healthcare. And then in the early part of the 20th century, around 1900, there was a need for healthcare here in this area.
Several Sisters of St. Joseph traveled by boat from Wheeling to Parkersburg to set up St. Joseph's Hospital back in 1900. I'm grateful that after the half sale of that hospital, that our foundation was able to be created so that we're still living on that mission of some of the early sisters of providing access to healthcare and also health, because we know that health is much broader than just healthcare.
Oh, I was a lot younger and foolish, and we took all kind of risks and things, but it was very exciting because it was such an opportunity for, especially as a member of the congregation, to keep the health and wellness ministry that had been here for over 100 years alive and well, but yet adapting it to the needs of the time, no longer just restricted to providing hospital, which is important, but not the only way.
And the heart of what we really wanted to do was to collaborate with the people, see what the needs were, and to address particularly the needs of the poor as far as health care is concerned.
And if I was, talking to someone that, was not aware of who we are, I would say that, we do what the early sisters did, which was to go into 16th century France into the community to see what the needs were, and then to come home and decide how they could respond. And we try to do that same thing in today's world, but here in the Mid-Ohio Valley.
We're funders to organizations, particularly 501c3s, nonprofits, and public institutions like churches, health departments, schools, and they are proposing grant requests to us that then promote health in their community.
But we also like to see ourselves as beyond just a grant maker and beyond a foundation. We try to connect organizations with one another, connect nonprofits with one another. We try to write letters of support and just overall try to be a support to the nonprofit community in ways just beyond providing grants.
Our region is only as strong as the people who live here, and really contributing to everybody having their healthy best life, healthy best self, really means a lot to me. And we don't have time for competition. We don't have time to waste energy on any of that or be working in silos. And so it means a lot to me that we're trying to help everybody find their niche, all the oars to be rowing in the same direction so that we can have real collective impact.
The first one is healthy eating, active living, promoting the education of nutrition education, for instance, or how to be more physically active, and also just trying to get people to think about their health as a way of preventing chronic disease or treating it. And there's the Thriving Neighborhoods priority area, and that is more centered on health equity or social determinants of health, because you live in context, right? So wherever you live, you work, you play, where you worship, it affects how you live, who you are, your health. So it's from everything from dental access to transportation to your medical appointment, to having a social connection with friends or the community. And the third one is the newest one, mental health and addiction. And so the recent 20-year commitment a couple years ago is to really double down and play this role as a foundation who really wants to make a difference in the Mid-Ohio Valley. And so this addresses primarily prevention and as well as recovery support and wraparound services, because sometimes those are the things that are overlooked, and we'd like to see where the gaps are.
Well, I think from the very beginning, what we tried to do was to listen. And if you really listen to the community, what you hear are what the current needs are, and they do morph over time. So we've continued to keep abreast of the needs of the time. That is a huge and a wonderful compliment to everyone who's had a part of this foundation.
This is what you should be doing. I would be highly suspect of a foundation after 25 years was doing exactly the same thing it did 25 years ago. You know, you're obsolete. So I just am really, really impressed by how proactive they are and also very sensitive to the community.
We really are open to new and innovative ideas that address health in our priority areas. We want to listen to them and respond to needs that they see really there and that they believe there's a good way to respond.
I think the thing that really is important for the foundation is the continued collaboration. You know, and it's around healthcare. They know that that's what it's about, and it's about unifying the community, which is kind of the mission of the Sisters of St. Joseph. We're really about unity among people.
I'd like to be able to look back and say we're still a really trusted, reliable, go-to resource for the region. As a new chair, I'm sort of excited to work with our board to continue to evolve with new grant-making activities, staying cutting edge on what philanthropy can do.
And I would encourage, you know, if there's organizations that are thinking about specifically the mental health piece of mental health and addiction, we encourage requests. You know, we know that due to the pandemic, anxiety, depression, and other mental health disorders have increased. So we were really looking for, you know, some new ideas, creative ideas on how community-based organizations can help support people with mental health disorders.
Well, I would hope that in the next 25 years, that all people would have access to healthy food. I would like to see all our communities thrive, have adequate transportation, employment, safe and affordable housing. And I'd like, in the mental health area, for the stigma to be reduced, for trauma-informed care practices to be available to everyone. I'd like people to be grateful that they live in the Mid-Ohio Valley because their needs are being met.